Is COPD misunderstood as a lung disease? Imagine thinking a cough is just a minor annoyance, only to find out it's something much more serious. That's often what happens with chronic obstructive pulmonary disease, or COPD. Many people see it as just a smoker's cough or a simple breathing problem, but it is actually a complex, long-term lung condition. COPD is not just one illness but a group of lung diseases that cause breathing difficulties. The two main conditions under this umbrella are chronic bronchitis and emphysema. Chronic bronchitis involves swollen airways that produce a lot of mucus, leading to a persistent cough. Emphysema damages the tiny air sacs in the lungs, making it harder for oxygen to get into the blood. Most cases of COPD are caused by smoking, but long-term exposure to air pollution, dust, or chemical fumes can also lead to it. The damage to the lungs is permanent and tends to get worse over time, which makes breathing more difficult. One reason people misunderstand COPD is because its symptoms can look like other lung problems. For example, shortness of breath, coughing, and fatigue are common in asthma, bronchiectasis, or pulmonary fibrosis too. But the way COPD affects the lungs is different. In COPD, airflow is blocked, so it's hard to breathe air out of the lungs. This is different from restrictive lung diseases, where the lungs cannot fully expand. Another reason for confusion is that some think COPD is only a smoker's disease. While smoking is a major cause, not everyone with COPD has smoked. Some develop it due to genetic factors or environmental exposures. Diagnosing COPD involves a detailed medical history, physical exam, and tests like spirometry. Spirometry measures how much air you can breathe in and out and how fast you can do it. Sometimes, imaging tests like chest X-rays or CORT scans are used to look for lung damage. Treatment focuses on managing symptoms, slowing the disease, and improving quality of life. This can include inhalers, pulmonary rehabilitation, oxygen therapy, and quitting smoking. Early diagnosis and proper care are key to helping people live better with COPD. So, to answer the question, COPD is often misunderstood as just a lung disease, but it is much more than that. It is a serious condition that affects many parts of life and needs proper attention. Knowing the facts helps reduce stigma and encourages people to seek the right treatment.